Should you high bar or low bar squat for disc herniation, sciatica, or low back issues? My name is Dr. Grant Elliott, here to talk to you about the differences between the two and what you should do. So a lot of people want to get back in the gym. They want to get back to squatting. They want to get back into these things and be strong again. But should they do a low bar squat like this or a high bar squat up on the traps? So here's the difference. Let's get a side view, all right? Here's the difference, all right? So first off, a high bar squat is up on my traps, right there. It's on the top of my traps, okay? A low bar squat is basically on the spine of your scaps, right there, or even below that on your rear delts, all right? This is personally how I do it. I'll have it right there, I'll pull back, and I'll do a low bar squat just like that. But what's the difference? Well, here's the difference. Now let's go to a side view. Here's the difference. When I do a high bar squat, okay, my center of gravity is closer to me. It's not as far out, it's closer to me, which gives me the ability to stay more upright through the squat motion. So I'm gonna have a little bit less bend in the hips, a little bit more bend in the knees. So my knees, there's gonna be more load on my knees, okay? A little bit less load on my hips and on my low back, all right? So I stay a little bit more upright. Now, as soon as I bring it down into a low bar squat position, it automatically makes me lean forwards more because it shifts my center of gravity farther forwards. My center of gravity goes forwards, which makes the bend greater in my low back and my hips and less in my knees. So that puts more load on my hips and on my low back. So here's what a low bar squat might look like, leaning a little bit more forward, just like this. While a high bar squat might be a little bit more upright, like this. See those differences? Now, I'm not saying that it's bad to have more load on your hips and your low back. That's not a bad thing. There's a reason why most power lifters do low bar squats, because they can lift more weight, because your hips and your low back are really, really strong, and taking less pressure off your knees tends to give you a little bit more leverage, all right? So that's why most power lifters lift that way. But if you are struggling with a low back issue and you're sensitive and you're really flared up, I would probably start with a movement that takes as much pressure off your low back as possible. So a high bar squat, or even a front squat, or a goblet squat. A goblet squat meaning just holding a weight in the front of your body. So let me show these real quick. So I might do either I don't want to smash that microphone, a front squat, okay? Or a goblet squat that is going to keep me in a more upright position and not as much of a hinged position, okay? So I would focus on those movements so that we can take a little bit less pressure off your low back, so you can build that confidence, you can build that resilience, you can start to get more used to that, load it up more and more and more, so that then, if you want to do low bar, you can. If you want to stick with high bar, you can. Who cares? But for the time being, let's stick with high bar options, or options that will keep you in a more upright position, so we can continue to learn how to fix your low back.